station and you get the tones drop, you get told by dispatch that you are en route to 145 Martin Avenue, single-family residence for a 64-year-old male patient short of breath.
Okay.
Timeout is 13:45 hours. And it's a clear day. Well, we can just kind of make it like today's weather and condition. As you go en route, you're updated that the patient's wife was the caller. He started having a sudden onset of shortness of breath about 15 minutes prior to the 911 call. He does have a pretty extensive respiratory history, and she'll be waiting for you at the front door.
Okay. That's good.
All right.
Medic 1 is on scene.
Okay. Go right ahead.
Walk up, knock on the door.
Mm-hmm. So an elderly lady meets you at the doorway, and she directs you kind of in an urgent manner to a living room recliner or chair where this gentleman is seated kind of forward in a position, in a tripoding position. You notice that he's having significant labored breathing. He's breathing shallow and increased work of breathing. You notice that he's pretty flushed. He's kind of got pursed lips, and he's pretty anxious. He's having a pretty hard time. There is on the desk or end table next to him, you notice that there's a small concentrator. He has a handheld nebulizer set that's just laying there next to him. And she says that he's tried the nebulizer with no relief.
All right. Hi, sir. My name's Joey. This is my partner, Chris, with the ambulance. Can you tell me your name?
All he's able to say is Dave, and he can answer you in about 1 to 2 word sentences.
All right. Since he's not really able to have my partner start getting vitals real quick, SpO2, blood pressure, set him up on end-tidal. And then I'd have to talk to the wife.
That's fine. I'll
he's
her
not
in
able
this
to.
interaction.
What kind of history does he have?
So he has congestive heart failure, COPD. He's a former smoker and had been diagnosed about 2 years ago with emphysema.
Okay.
He's had some DVTs. He had a couple heart attacks in the past. The last one was probably 10 years ago, 15 years ago. And as far as he does have diabetes as well. He's diabetic. And that's kind of all we can think of at the top of our heads as far as pertinent history right now.
Yeah. Do you take a listen to lung sounds real quick?
So you're auscultating the lung sounds, and you hear coarse crackles throughout all fields, but significantly diminished in the bases.
Significantly diminished in the bases. All right. What do I get for an SpO2?
On room air, well, I shouldn't say that. He's on 4 liters normally at home,
Okay.
2 to 4 liters at home. You get an SpO2 reading on his 4 liters nasal cannula at 88.
88. All right. Blood pressure?
Blood pressure comes back initially baseline at 151 over 110.
All right. Heart rate?
Heart rate is 135.
135. And then my partner has end-tidal now.
Sure. End-tidal reading initially comes back at 64.
Okay. Waveforms? What are they?
Waveform, good waveform on the end-tidal. You're kind of sealing, kind of almost like a shark fin
Okay.
type.
And then what's his respiratory rate?
Respiratory rate is 45.
45.
Initially.
All right. So the coarse crackles. Have you ever had CPAP before?
He has had CPAP in the past, yes.
All right. So I'm gonna have my partner set up CPAP.
Okay.
We'll start giving him CPAP. Almost seems like he might be having like a CHF exacerbation with coarse lung sounds and everything. It seems there's fluid in the lungs.
Okay.
He's having difficulty breathing right now, so that should help get his airway open and help get air into him.
Okay.
So I'll have you set that up, and we'll just start with the base peak of 5.
Sounds good.
And then, do you have any? Does he have any allergies?
No allergies to medicines that we know
No
of.
allergies. Oh, okay. When was the last time you had something to eat?
He did eat lunch. He had like half a grilled cheese sandwich and a little bit of orange juice.
Okay. And well, what was he doing when this started?
So he's not really ambulatory well. He does get around with a walker, but he's just kind of become more lethargic this afternoon. He wasn't really doing anything noticed kind of an increase in the difficulty breathing, and then it got significantly worse, just kind of seated. And then we got set up with his nebulizer treatment, and that just didn't seem to help relieve anything at all. Usually he finds relief with that.
Okay, so, let's see.
Take some deep breaths or
I'll have you also get an IV started for
IV?
me. Yeah, want some IV access, possibly get some nitro. So, I think, once he gets this IV started, I think we should, if you want to go to the hospital, then we got the ambulance.
Yeah,
and-
you'd like to go.
All right, once we get this IV started,
Wanna start again?
yeah, why don't you start it real quick? And, what medications is he on?
Oh, let's see, so he takes, clonazepam for anxiety, depression, he takes diltiazem, he does have a history of AFib. He takes insulin for diabetes, he's got Lasix for, a water pill, he takes Plavix, and, levothyroxine as well.
All right, did he take all of his medications?
Medication regimen has been taken this morning, he's had no changes to his medication or anything like that, no dosing, nothing's been removed or added recently, so everything seems to be pretty normal there.
I'm gonna quick throw a 12 lead on him while my partner's getting that IV started. And how old is he?
64 years old.
64. So I'd set this up for getting a 12 lead,
Okay.
and I'd run it.
Yep. He's able to sit still, you get a good tracing on the 12 lead. The printout shows, atrial fibrillation through all leads. You're finding some indicators of previous, ischemia in the past due to the previous, cardiac history. But nothing new that's causing alarm.
All right. Yeah. So I would, as my partner's getting the IV, I think I'd want to start probably a nitro drip
Okay.
to help, because his blood pressure is elevated, and so nitro should help open the vasculature, help maybe push some of that fluid out of the lungs as well.
Okay.
So I'd want to set up, the dose would be 10 micrograms a minute, and so it'd be mixed in a bag, and so I'd run it, titrate it really to effect.
Okay.
Mainly.
Okay.
So, but I'll start that once we get him out to the ambulance, that way if we get going.
Okay.
we're-
You can feel free to put him on the cot. You can,
Okay.
I'd like to kind of orchestrate it like you would in real time. And that'll get us through at least the majority of the time of the scenario.
Okay, so why don't we, he can try and stand and pivot if he can stand.
He's gonna be able to stand, it'll be a 2 assist
Yep.
for stand, just because he feels extremely weak
Okay.
and anxious and struggling.
Yep, so what we'll do is we'll do a stand, assist him up, and then pivot, set him on, and then we can help get his legs up. Right, 1, 2, 3. Okay, now we're good. His legs up.
Oh, you can kind of put this way, or the, get this out of the way, this is just the.
Up there.
Not on this one.
I think so.
Alright. So we'll start moving him out to the ambulance.
Okay.
once we get out to the ambulance, I'll have my partner hop up right away and we can get going to hospital. I'd ask the wife if she knows, what hospital she'd like to go to, or if they have any preference.
The closest one will go to Mayo.
Alright.
You have about a 4-minute transport time, about a mile and a half.
I'm gonna go drive.
Almost 2 miles.
Sounds good.
So you're gonna
So,
drive?
Okay.
I'm gonna start that nitro drip.
Okay.
10 micrograms a minute.
Okay.
Or titrate it to whatever effect, so that it just kinda helps. With 4 minutes out and the condition of the patient, especially being on CPAP, I wanna give them a regular report early.
Okay.
So CVC medic to Mayo ER patient care report.
Go ahead. This is Mayo.
How old is my patient again?
64.
64. We're in an out-tier facility, approximately 4 minutes out with a 64-year-old male, chief complaint of difficulty breathing, have, coarse, crackles throughout all fields, slightly diminished in the lower bases. Currently on a CPAP, PEEP of 5, and we have a 16 gauge IV started in the patient's right AC, currently running a nitro drip at 10 micrograms a minute. Latest set of vitals, I run through SpO2 on CPAP.
With the CPAP, he's at about 95.
95%, end tidal,
End tidal is 49.
pulse,
Pulse rate is 128.
blood pressure.
Blood pressure comes back at 139/110.
Okay, any questions or orders?
No, sounds good. We'll see you upon arrival, room 8.
Sounds good. So then we run it like this and continue the same care to the hospital.
Okay. Okay.
Probably listen to lung sounds again, and then, yeah.
Reassessing lung sounds, you continue to hear crackles. There's still
Okay.
crackles there.
Yeah.
They're not as coarse, but they're pretty pronounced.
And he seems to be improving a little bit with the C.
Yeah, so
there's a
he's
little bit
able
with
to
the
speak
CPAP.
to you in about 6 to 8 word sentences at this point. Color condition seems to be improving. The anxiousness feelings kind of coming down. He's feeling like he's getting help with the CPAP. The nitro infusion would be probably something he'd be finding relief with as well.
Mhm.
As far as reassessment, that's kind of where you'd be standing
Mhm.
right now.
Okay, yeah, so I just wanna continue the treatments that I'm running right now to the hospital, and, they'll definitely wanna know, they definitely want to know the CPAP early so that they can get respiratory there.
Yeah, good idea. Okay.
So, yeah. Do you like this was right to the hospital?
Okay.